Hey everyone, welcome to the Freedom to Flourish podcast. I'm Dr. Joel Miller here with my good friend and colleague, Dr. Tim Augustyniak. Today we're talking about bacteria. We're going to go through bacteria in just kind of an aerial view, and then we'll also dig into some of the specifics with bacteria in general. We'll talk a little bit about MRSA, Lyme, and a number of other bacterial conditions and bacterial-related issues. We just did our last episode 56 was on the topic of fungus. Our next episode will actually be with a guest speaker. And then after that, we'll get into parasites. And so, again, to kind of reiterate the purpose with these, the purpose is, when we talk about what are the root issues behind people's health problems, a lot of times we talk about that. We say root cause, the root issue, let's get to the root. Well, what are they? Well, one of the biggest components are infections. And so we wanted to kind of walk through the main things that we find: fungus, bacteria, parasites. We'll do one on viruses, I'm sure, as well. And we'll kind of keep going with things as far as these root topics go. Dr. Tim, it's good to see you. That beard is looking beautiful today. And I'm excited to jump into this with you.
Oh, thank you. Thank you. I got it all trimmed up just for this. But ready to go. I think this is going to be a really, really good episode. We got plenty of stuff to get into. A little bit of this is going to be a repeat from the fungus episode just because there's a lot of overlap. Yeah. But hopefully our listeners will get some useful information and pick out the differences between this and the fungal episode and better identify what's going on with their health and how to fix things. So let's get into it. First things first, what even are bacteria and where do they come from? Why don't you walk us through that?
Yeah, so obviously bacteria are microbes. They are microbial cells that essentially are, everywhere. And I know it might be a little bit silly to say, but one of the things surrounding bacteria is this idea of like, if you get exposed to bacteria, you're going to get sick, they're associated with sickness and things like that. But in reality, bacteria are parts of really what makes up kind of our microscopic, basically layers of life, if I can kind of put it that way. And what I mean by that is, we have good bacteria, we have quote unquote bad bacteria. And one of the things that, we may get into one of these days is talking about the terrain theory versus the germ theory. And in reality, it's like, are there actually such things as bad bacteria? Or is it more of the bacteria in a certain environment, in a certain scenario, that then leads to different issues? And so it's kind of an interesting conversation we may get into at some point on this podcast. But as far as bacteria and the sources, obviously we're going to find it in our water. We're going to find it in our food. We're going to find it in our just environment on different surfaces. We have tons of bacteria on our skin. We have tons of bacteria in our mouth. We have tons of bacteria in our gut health. We have bacteria all kinds of places. And one of the things that we like to focus on when we talk about bacteria from a clinical perspective is, and we'll get into this here in this episode, but yes, you can have all these different symptoms from bacteria when you have an infection. But one of the big things that we'll talk about is, what's going on with your immune system. Bacteria don't just cause issues because they're present. They cause issues because, again, the environment, the weakening of your immune system, and that kind of opportunistic kind of scenario where bacteria can jump in and start causing issues. So we'll get into that here in a little bit. Dr. Tim, anything to add to that? I generally love to keep it somewhat surface level with things, but I also know there's probably a number of other things we can add to that when just talking about bacteria. What are the things that our patients really need to know about there?
I think it's important to highlight, well, one, when you say, opportunistically bacteria can cause problems, I'd like to kind of dive into that a little bit more and what that really means. So if there are bacteria present, that does not mean that it's going to grow out of control and our body's going to have to deal with it. So when we think of bacterial issues, you think of, like with a cough, for example, you're going to have really yellow, green colored phlegm. You're going to blow your nose, it's going to come out, things like that. Or, things like gut infections, you're going to have lots of bloating, gas, diarrhea, constipation, all depending on what's going on. Now, just because there's bacteria there does not mean that you are required to have these symptoms. It's just whether the immune system can keep the bacteria from replicating at a significant rate. Because whenever there's food present, whenever there's warmth present, when there's moisture present, bacteria are going to grow. So they're going to feed off of dead cysts, dead skin cells, dying tissue that our bodies are basically producing. They're going to feed off of the food in our gut. They're going to feed off of indigestible fibers. They're going to feed off of different fats. In some cases, even proteins. It just depends on what's present. So if they're feeding off of basically everything, and they can grow basically anywhere because there's typically warmth, there's typically moisture, there's typically food, whether it's in your gut, whether it's in your mouth, whether it's in an area where you have a cut on your skin, whether it's your groin area, things like that. There's always those things for bacteria to grow with. And so how does our immune system go through and make sure that this doesn't get out of control? Well, it's just the idea of the Th1 and Th2 balance, where when you get in this Th2 dominant state, where your immune system is hyperreactive to everything environmental and not necessarily infectious things like bacteria, viruses, you name it, you're going to become more susceptible to these infections replicating. So our Th1 side of the immune system is not going to be able to kill off these bacteria before they overgrow too much. And so you start to develop issues like bloating, gas, or you'll get pneumonia if you come across it and the immune system can't fight it off, or any sorts of other issues that could be bacterial problems. So it's all the theory of reactivity. If our immune system is reacting to it in a way that it's kind of overgrown and causing all kinds of symptoms, and our immune system has to gain ground backwards, that's kind of an oxymoron. But it has to backtrack and get that bacteria from way overgrown and being a big problem all the way back down to a reasonable level that is not enough to actually cause a big problem with the immune system that it has to significantly react to, then we're good. So it's all about keeping things healthy and at a neutral level where the immune system doesn't have to ramp a big attack. It's just a constant battle of minor issues to keep that bacteria at bay, as opposed to totally gone or totally overgrown. So it is at a tolerable level and in balance with our immune system, essentially. So anyway, just to get into that a little bit more, I think hopefully that'll make a bit more sense with our listeners.
Yeah, totally.
But
Totally.
Getting into our next point. So with bacteria, I think it's important to talk about different types of issues. So what kinds of infections can we get? All sorts of things. So we can get gut infections, skin infections, respiratory issues. We already basically touched on all of that, mentioning the gut infections like SIBO, like a fungal overgrowth in the gut, or a bacterial overgrowth in the gut. All those things are going to lead to something called SIBO, SIFO, or even a large intestine dysbiosis where the microbiome is out of balance. Skin infections. So you can get things like MRSA, which we'll talk about more later on. Or other bacteria can move in and cause infection. Say if you get a cut on your hand, or things like jock itch. Those are all issues that can arise because of bacteria. Upper respiratory issues, you can get things like strep throat. You can get pneumonia, things like that. All sorts of things that bacteria can basically move in anywhere, cause all sorts of infections. So we kind of have a point here on our note that says infections anywhere, ... So basically, bacteria can move in just anywhere in your body. It's not necessarily just these examples that we're going to give. There are some signs and symptoms with bacterial infections that make it easier to identify, but it doesn't necessarily mean that it can be limited to one place or another, limited to any of these symptoms. It can really be just about anywhere, and a lot of symptoms will manifest as a subclinical bacterial infection. It doesn't really classically identify with a bacterial infection. That's why things can be funny, and that's why we utilize the techniques that we utilize to identify what's going on. At least with these points, Dr. Joel, do you have anything else to add on as far as it goes for types of infections? But we also put in here various clinical examples of weird cases that we've come across in our practice, just to provide some more examples of bacterial infections that we found.
Yeah, I would say that's a great overview of just the different types of bacterial issues. And of course, the kind of the next thing we were going to jump into was the signs and symptoms. And you can essentially take each of these different things here and break them down into a different category. You know, bloating and gas, for example, we mentioned SIBO. That's going to be more of a bacterial issue in the gut. You know, cellulitis, maybe a staph infection on the skin, MRSA, impetigo, or epitigo, depending on how you pronounce it. Those are all going to be common issues with bacteria in the skin. In the same way, you know, you mentioned respiratory issues and pneumonia and things like that. And then there's, you know, just in general, other types of issues that you can get with bacteria, right? So strep throat obviously is really common with the streptococcus bacteria there. Tonsillitis, which is usually driven by significant bacterial issues. There can be viral problems there as well. H. pylori issues, which is often in the stomach. E. coli, salmonella, again, those are often in the gut health and the stomach as well. Lyme disease, which we did Lyme disease and just tick-borne illnesses to kind of put all that together, which we did a whole episode on that. I think that might have been episode 50, but that was a big episode. Anywhere you have a significant sign of inflammation is one of the big indicators of like, hey, there might be an infection here. If you think about something like cellulitis, you have this spot pick up here, pop up somewhere on your skin. It has pain, it has redness, it might be swelling, it might be irritated. Those are all signs of, hey, this might be an infection. Obviously, if you have a fever, that's a sign that, hey, there could be a bacterial issue. One of the things I always encourage patients with when it comes to sicknesses is if it's a bacterial issue compared to like a viral infection, you're going to have more of the yellow and the green phlegm. If it's viral, it's going to be more clear mucus and that kind of thing. UTIs, ear pain, ear clogging, maybe a persistent cough, swollen lymph nodes. These are all things that can happen from bacteria. And of course, like we said, it kind of depends on where it is in the system and how it's impacting your body. All of that to say, Dr. Tim, we're always focused with the patient on figuring out why is your system not overcoming this? And your body should be able to overcome different infections. Again, it's not the presence of the bacteria itself that's going to cause issues. It's the presence plus kind of the weakening of the immune system and your immune system not being able to handle things properly. Dr. Tim, anything else, any other signs, symptoms, things that you kind of add to that when you think about bacteria, when you're talking about bacteria with patients, different things that you might see, or any of the different kind of weird cases that you've seen in office there?
I think it's important to talk about one thing that we did mention on here is things like fever. So a lot of times when you have bacterial infections, you'll start with a fever. So if you have, for example, like strep throat, a lot of times you'll get a fever with that. Lyme disease, very acutely, a lot of times you will get a fever. Ear infections, kids can run fevers. Persistent coughs could be with various flu bugs, also pneumonia, bacterial pneumonia, things like that. Could also be, fevers, things like that. But when it comes to more topical, local issues, typically heat, redness, swelling, super common symptoms.
Yep.
When it comes to internal issues, it can be a bit more difficult to pin down. A lot of times you're not going to run fever. It's going to be more specific symptoms depending on what the issue is. So, say it is like a food poisoning issue. A lot of times it's not going to be fever, but very acutely, you're going to get diarrhea, you're going to get a lot of gas, food's just going to go right through you, all that stuff. And then that can kind of transition from like an E. coli, salmonella, food poisoning into later on just a functional SIBO issue once the immune system calms down that acute infection to a reasonable degree. But then with things like Lyme, it can be totally different in that very acutely you have lots of fatigue, fever, maybe a bullseye rash at the site of the tick bite. lots of things that are very characteristic of an acute Lyme infection, but you can add this a little bit. But with Lyme, it can be some weird, deep-rooted symptoms that manifest as autoimmune conditions, or they manifest as skin conditions, or it manifests as hormonal issues and difficulty getting pregnant, for example. So it's just this huge immune system battle long term that's not necessarily seeming to be a Lyme infection, but that might be the one thing in the background that's very low grade that is just causing havoc everywhere in the body. So when we say signs and symptoms of bacterial issues, it's not just limited to fever. It's not just limited to redness in the skin. It's not just limited to cough or upper respiratory stuff or things along that line. It can really be just about anything from fatigue to headaches to blatant, just yellow colored sputum that comes out when you cough. It really can be all over the place. One of the weirdest examples that I have, and I think I've mentioned this before, but I had a patient who came in. She only came in for 3 visits, and the issue was 100% resolved and still is resolved. But she came in with a benign bone tumor and had been through the woodwork with all the specialists trying to figure out why it was giving her so much pain, to the point where it was really inhibiting her ability to run. It was inhibiting her ability to play sports. It was inhibiting her ability to just stand on it for extended periods of time. And nobody could tell her what it was. They couldn't find the infection. It was just this bone tumor. And in hindsight, I really truly believe that it was a Brodie's abscess, which is a sequestered infection that's found on imaging. That supposedly the idea on it is your immune system will sequester and seal off with bone this infection in the bone, and then the immune system will kill off that infection. Therefore, it's just this hollow pocket in the bone. They weren't able to actually find any images for me to look at, so I can't confirm that. But with the lack of ability to find a legitimate infection or anything that was really wrong with it, it seems to make the most sense, especially where it was presenting. But that being said, we, through the systems healthcare technique, found that there was a bone or a infection somewhere, and all of the indicators were pointing to it being in her leg where the pain was. Gave her an herb day 1. By day 2, the pain was basically half. Gave her another herb, and by day 3, there wasn't any change from day 2. So I was like, oh crap, what are we doing here? Ended up finding an aldehyde toxicity at that point. That was the only thing I could pull to the surface. Infection seemed to be gone. It was just the byproducts of the immune system killing off that infection. Gave her molybdenum to help clear that for, I think it gave her enough to do a month. Came back a month later, and she had, in that time frame, gone from not really doing a ton of sports to she was running in a cross-country meet that following weekend and had absolutely zero pain. And that's why we do the systems healthcare technique.
Yep.
So when I say symptoms don't necessarily have to be any of these that we've mentioned. It can be as weird as you have a weird pain in some spot that doesn't seem to make any sense. And it can be some sort of infection that's taking place there. Bone infections like that can move into any place where blood flows. So you can get, back when we're in school, we learned that, a dampened immune system can make you susceptible to things like osteomyelitis, where you get a bone infection like the spine or the femur, things like that, because of things like autoimmune medications, biologics, those types of medications. It can be because of chronic infections elsewhere. It can be because of chronic toxicities of metals. It can be anything that really dampens your ability to fight off infection. So don't count that stuff out. Random pains in bones somewhere throughout the body. A lot of times if these are big infections, it will also have fever, things like that, but it can really be a whole slew of symptoms. So that is our summary of what bacterial issues can present as. And really it is just about anything. So if you are curious, there's various testing that you can get. But that's where a lot of times it's, let's do a biopsy. Let's do a sample. Let's see what grows in a lab. And a lot of these things, it's really difficult to identify, even with trying to do that. So that's why we rely on the techniques that we rely on, because you have weird symptoms and weird things that come together. Sometimes you gotta, use a different approach to find things and a less invasive approach to solve this. So anyway, Dr. Joel, anything to add to that?
Yeah, no, the focus there that I so appreciate is essentially just understanding that when we talk about you have whatever health issue or symptom you have, there's a reason why, and we call those the root issues. And the bacterial infections can oftentimes be a big driver of that. And so, yeah, when you talk about, hey, maybe you have like weird symptoms that don't seem to line up with certain things, one of the things you should always be thinking about is, could it be an infection? And Dr. Tim, we haven't mentioned this in a while, but I think a lot of times when we mention infection, I think the listener might think, oh, fever, very obvious type things. But one of the things that we often find that people deal with is what we call subclinical infections. And subclinical infections are kind of this category of infections that they're present, they're causing issues, but those issues are not super profound in the sense of a fever and, green or yellow phlegm and a swollen lymph node and things like that. But you can still have these subclinical infections that they're there, they're causing inflammation, they're causing problems, they're causing dysfunction and pain, and it's still an infection. So understanding kind of the differences between your just general infection versus subclinical infection, I think can be helpful with how we're talking about things. One of the things we kind of left off our list here, Dr. Tim, as far as different types of infections, signs and symptoms, all that fun stuff, is appendicitis. Appendicitis usually derived from a bacterial infection, and it's one of those things that you want to take very serious. You don't want to mess with that, because if it does get significantly worse, either the appendix ruptures, or you can eventually, either you have to have it removed or it ruptures and it can develop sepsis and that kind of stuff. So you definitely want to take those things serious, but that's usually due to a bacterial issue there. Dr. Tim, to jump back into how to identify, you mentioned a couple of things, with the testing and so forth. So obviously we love to jump into the muscle testing, the applied kinesiology, the systems healthcare stuff. And we do that because, number one, we're able to get to the bottom of things rather efficiently. And then number two, there's a huge component of accuracy where it's like, we figured out what it is and we figured out what herbs or nutrients or whatever we need to do to address it. So because of those things, we kind of stick to our guns with that. There are other methods and kind of means to address some of these things, right? And of course, it depends on the type of bacteria, depends on maybe the area, the system that's impacted, right? So what are some other ways that we can jump into bacterial stuff? We have a very, very common blood test called the CBC, complete blood count with differential. So you want to look at the total white blood cells. They should be optimally, the general optimal range is between 5 and 8. I know, Dr. Tim, sometimes our ranges vary just a smidge, but roughly 5 to 8. And then you want to look at the neutrophils. Those are probably going to be the biggest thing when it comes to bacteria. So in an acute infection, you're going to see the white blood cells increase. You're going to see the neutrophils increase. The neutrophils should be about 60%. You'll see those increase up to 65, 70, 75, 80%. And then in more of a chronic nature, you're usually going to see those white blood cells drop down. You'll see the neutrophils drop down with it, essentially because your immune system is just having a hard time kind of being worn down over time and losing kind of the battle to this infection. So there's a couple of things there. Obviously, Dr. Tim, with gut tests, with gut bacterial issues, SIBO, we can run stool tests. One of the things we talked about in our last episode was with stool tests, usually we don't depend on those super heavily for different gut issues. I know I especially don't depend on them for checking for parasites or fungal issues, but I generally find that they catch a lot of imbalances when it comes to bacteria. Now, the test gives us information that can be helpful, but we don't always do it just because a lot of times we don't need to do it. But obviously a stool test can be helpful there. Dr. Tim, whether it comes to bacterial infections in the body, on the skin, in the gut, are there any other little tests, anything else that when a patient thinks about, hey, I want to get this checked out, what maybe tests should maybe they be thinking about?
Just like you're getting at, it all depends. Sorry, go ahead, finish what you were saying.
No, I was just saying if there's anything else. I know we've covered, most of them.
Yeah. So to your point, it all depends on where the problem lies. So there are various titers that you can run to see if there is a current Lyme infection, a past Lyme infection, if you have antibodies for Lyme. There's a couple different indicators that you can use in a full Lyme panel, for example. Things like H. pylori, there's an H. pylori breath test. And so you can just do that, and it's quick and easy, and it tells you if you have H. pylori in your stomach. But a lot of times there's false negatives, I would argue, with that. And if you have some sort of chronic heartburn issue, food sensitivities, things like that, that just cause indigestion in the stomach, and we're suspecting H. pylori or some sort of stomach dysbiosis, a lot of times I would venture to say that it's not always H. pylori. That's the popular one that people think is the only one that can cause infections in the gut. But if you're doing a test for just H. pylori and there's some other bacteria driving it, you're not going to find it. A dermatologist, I'm sure, would run all sorts of biopsies for all sorts of skin issues to see if there's anything going on there. If you have rashes or impetigo or MRSA, those are identified through biopsy of the skin. Now, depending on the underlying actual specific lab test to do that, and how the biopsy works and everything, is totally not my wheelhouse, but skin samples are super, super common to take and then do biopsy for various skin issues. Urine samples for things like UTIs, kidney infections, bladder infections, you name it, also super common. It all depends on what the problem is. Bacterial issues can really, like we said, they could be just about anywhere and can have a whole lot of problems. If you're suspecting something like osteomyelitis, bone infections, they could, first off, imaging, X-rays, always going to be first thing on the list, especially for insurance reimbursement purposes. But then from there, MR or CT are going to be super, super common with their various weighting on the images to identify if there is pus and things present. And of course, if that's the case, it's going to hurt like absolute crazy. You're going to have a fever. But then in order to identify what sorts of antibiotics are going to be most helpful for that bacteria, they'll often do a aspiration, which also basically sounds like hell. And then they're going to give you an antibiotic that is very, very specific for that infection. So lots and lots of things that can be done. So that kind of leaves it to, well, if there's so many different things that can go on with bacterial issues, how do we fix it? And what makes you susceptible to it in the first place? So we kind of have a little bit of a list here for what causes these things. But why don't you take us through and just give us your take on what causes it, and then if there's anything that I think of, I'll just follow up with that.
Yeah, for sure. Yep. So I generally mentioned it's not just the presence of the bacteria, it's the presence plus your immune system is susceptible. So one of the things we'll talk about when it comes to just immune system stuff in general, whether it's strep, whether it's a swollen lymph node, whether it's a chronic just infection that you can't get over with your immune system and that kind of thing. One of the biggest things we talk about is this imbalance with the immune system. Specifically, we talk about Th1 and Th2 and what's called Th2 dominance. Now, the general kind of brief way I explain it with patients is you have two different components here to your immune system, Th1 and Th2, and they kind of function together. They function together, but almost in a reverse way. So if you have with Th1, if you have a virus, a bacteria, or fungus, Th1 goes up, Th2 drops down. Your immune system takes care of it, comes back down, balances out. Your body, your immune system is about balance, and it's able to go one way, address things, balance back out, and be mobile, be flexible, that kind of thing. With Th2, if Th2 is driven up, one of the things that's going to do is it can increase in histamines, it can increase inflammation, things like that, but it will simultaneously suppress Th1. So one of the things we talked about in our last episode with fungus is if you have a chronic fungal issue, if you have a chronic bacterial issue, sometimes the problem is not actually the bacteria or fungus. It's that your immune system is driven up with the Th2 response because of parasites, food allergies, sensitivities, heavy metals, breast implants. The list goes on. Stress is a big one there as well. So I've had a number of patients, a lot of times this happens with kids, Dr. Tim, where they've had some kind of vaccine, there's different heavy metals in it, things like that. It drives up this Th2 response. And because of that, they get sick. And not only do they get sick, they're sick for like 3 weeks. So by the time I see them, obviously they've been ran down, they're exhausted, all these things, the parents too. The parents are exhausted, that is. And one of the things we'll do is we address the heavy metals, we address this imbalance with the Th2, we bring that down, and sometimes that alone will clear up their bacterial issue. Sometimes we also have to support the immune system with addressing the bacteria, but that's usually a big issue. Stress we talk about, when we talk about infections with bacterial issues in the gut, one of the biggest things I find with that is other infections, whether it's parasites, whether it's fungus, things like that. Sometimes you can have poor digestion that contributes to kind of a weakened immune system in the gut. So when we talk about the stomach, we talk about low stomach acid. When we talk about like SIBO type issues, you know, if you have poor bile flow, bile is made in the liver, it is pushed out with the gallbladder. And if you have poor functioning there, then the bile is not going to flow through the gut. And one of the components of bile that we talk about is, yes, it helps digest your food, it helps absorb fats, it helps move your food through, helps with bowel movements and all those things. But one of the things it does is it also keeps the different bacteria in the microbiome in check. It has different antimicrobial properties as well. And so if you have a number of different issues like stress, poor nutrition, inflammation, hormone imbalances, things that are going to stress the liver and the gallbladder system, then that can reduce bile flow. It can contribute to bacterial imbalances in the gut, and that leads to gas and bloating and all the different things. Dr. Tim, I think I've exhausted my list there for susceptibility with the immune system. Anything else that you would add to that? If not, let's jump into, okay, how do we address these bacterial issues?
Absolutely. Just to wrap it up, basically anything else your immune system is taxed with, long story short, whether it's stress, whether it's Th2 issues, you name it, there's basically a giant laundry list of things that can contribute to that. The last thing that I think is important to mention, just to highlight that bone infection talk before, different medications that deliberately suppress the immune system will make you susceptible to bacterial issues as well as other infections. And some of the most common ones are things like biologics medications, things that will treat things like psoriasis, eczema. One of the most common ones that I will see commercials for every now and then now is Dupixent. It's getting to be a really popular biologic medication for eczema. And yeah, it can be really nasty stuff. So all of those medications, if your prescribing physician, if you're listening to this and you're on biologics to help with psoriasis or eczema or you name it, and your prescribing physician did not talk to you about the side effects that are potential with that, I encourage you to read the list of side effects on there because they really can't the immune system. Of course, it's not our scope of practice to make recommendations on medications, but it is one of the pillars of evidence-informed practice is informed consent, and ensuring that our patients are understanding of what they're getting themselves into. And whether it's all the natural stuff that we do or anything that you do on your journey with your medical doctor or any sort of specialist, make sure you know what you're doing and make sure you know the risks as well as the potential rewards with whatever you're doing. So anyway, let's get to how to get rid of bacterial issues. So, of course, depending on whether it's a gut issue or if it's an H. pylori, or I guess that is gut, or like a Lyme issue or UTI, there are various herbs that are going to be more or less helpful depending on who you're dealing with. And so one herb can be helpful for gut with one person, can be helpful for, say, like UTIs with another person. There is no way to predict 100% whether or not, say, neem is going to be really, really good for person A for their gut, and then it's going to be great for person B for their gut. There's no way to pick that for certain. And then, of course, we always talk about this theory of, do the herbs actually kill anything off, or do the herbs help modulate our immune systems to then kill things off?
Yeah.
Say your immune system is completely different than my immune system. If the case it absolutely is, it would make great sense that some herbs will do really, really well to help with issues that I have, and they're not going to do quite as well with issues that you have. Now, that may be true, but at the same time, this is something that we talk about all the time. Depending on where you're at in the country, where you're at in the world, what sorts of issues are more or less prevalent in your environment, some herbs may be more helpful in some areas than others. one of these that I already mentioned at Neem, that's one that back when I was in Minnesota, we used to see that one test all the time. Down here in Arkansas, quite honestly, it doesn't test exceptionally often. And I wonder if that's just the environmental that we are dealing with down here, the different strains of mold, bacteria, things that are affecting the gut, you name it, that are down here that are different than up in Minnesota. Not sure. We can have theories and ideas on that all we want, but all that we know is, say people on the East Coast will find iodine test less often than those that are in the Midwest, where it's just not as readily available through the ocean air, and more fresh seafood and seaweed, kelp, things like that that are available there. So there's various things that can be more or less helpful in certain areas of the country if different environmental things that change it. But long story short, in order to fix an infection, you need to do some sort of antimicrobial herb to correct infection, as well as deal with the byproducts of the immune system doing its job to make sure that the immune system can continue its job. In addition to that, you talked about Th2 dominance, things like that. All of these things that will make you more susceptible to bacterial infections may not make you, they can make it difficult to get rid of the infections, but you can get rid of an infection, and because you're still susceptible, you can get another one very quickly. And so it's a game of balancing that stuff as well. So, Dr. Joel, what would you add to that? How would you go about maybe balancing those things?
Yeah, no, that's huge. Yeah, I love how you kind of broke it down, and I continue to second that and add to that. If it's a gut issue, obviously we're going to look at nutrition specifically. We're going to follow maybe a low FODMAP diet for a time if you have a significant amount of bacterial issues like SIBO, things like that. But then, of course, we're going to look at herbs. Now, Dr. Tim, one of the things I don't think we've mentioned yet this episode is when it comes to checking herbs on patients with the muscle testing, obviously we'll find one or two herbs that's going to work perfectly for that person, or it's going to be the best for that person. But when it comes to the bacterial herbs that we're checking, there's like 25 or 30 herbs that we may check. Like, that's how extensive that list is. When it comes to parasites, it's maybe like 6 to 10 different herbs that we might check. And so the point of that is that if you're going to try different herbs, you're going to possibly run into a lot of frustration, because the likelihood of finding the herb that's going to be great for you and best for you just based off trying is somewhat slim. And so when on these episodes and on social media and all these different things, we try to give like the top recommendations of like, hey, these are usually the herbs we see people need. But really, in a best case scenario, if you have some kind of a chronic issue, I would definitely recommend working with just kind of a professional to actually go in, muscle test, and figure out what exactly you need. It's going to take a lot of frustration out of things. It's going to help your body and speed up this healing process and that kind of thing. So wanted to mention that. But we have the gut stuff. Anything immune system related, Dr. Tim already mentioned that. Balance the immune system, support with different herbs. Grass-fed butter is amazing for your immune system. Getting enough protein is huge for your immune system. Obviously, sugar and processed foods are all going to suppress your immune system. So you have some of the basics there that you want to address. And then one of the big things, when we talk about the immune system is obviously things like vitamin D, vitamin A. I mentioned the healthy fats with the butter. If you have an iron deficiency, that's going to suppress your immune system. And so one of the things we talk about with iron is that it's usually deficient due to infections, and so a lot of times when people take an iron supplement, it may help. A lot of times I find that it doesn't, but it may help. But ultimately, it may be feeding an infection, whether it's a bacterial infection, parasites, or fungus. Those things will tend to feed on iron and then cause the iron deficiency. So you definitely want to consider that. If you have any kind of skin issue, I always mention this, Dr. Tim, because I don't think a lot of people realize or understand this. Skin infections are not something that you need to address topically, I would argue. Every single skin infection I've seen, every single patient I've seen with that, anything I've had myself, those things you address internally help support the immune system, and then the immune system will get rid of the issue. So I've had multiple patients that come in with cellulitis. I've had multiple patients that come in with, I had a sweet young girl that's come in these last couple of weeks here with MRSA all around the lips, the mouth, the ears, the eyes, all these things. And essentially, actually, it wasn't around 8 years, but it was around everything else. Essentially, what we found is different herbs, different nutrients to balance the immune system and balance the gut health. And it's slowly going away. But it's one of those things where she was on all these creams, all these topical substances for months. And it might keep it at bay. It might help. But as soon as you stop the creams, boom, it just comes back. And that's because the immune system is not supported properly. The immune system is struggling. So when it comes to skin issues, you got to go internal. You got to address the immune system, things like that. Anytime there's a swollen lymph node, Dr. Tim, I find this all the time. Patients come in, they've had some kind of chronic swollen lymph node. Their doctor doesn't really know what to do about it. Maybe they recommend a biopsy or imaging or something like that. Maybe they do some MRI or some kind of scans to check for cancer. Anytime you have a swollen lymph node, there's an infection going on. Lymph nodes are centers, as I kind of refer to them, of your immune system cells. And so if it's swelling, if it's irritated, if it hurts, there's something going on with the immune system. I've had countless patients that come in. That's one of their complaints. We jump into things. We find out, oh, there's some kind of bacterial issue, parasites, fungus, something like that, viruses. We address those things through nutrients and through nutrition. And the lymph node swelling goes down, the pain goes away, and it goes back to normal. And so a lot of times, again, the emphasis is check out the immune system and support the immune system. Dr. Tim, I think that's mostly all I have. There's so many different things, you know, with the topic of bacteria that we could probably get into and go on and on and on. Anything else to add to how do we get rid of this? Do you have any other thoughts there? And then number two, let's share maybe the top recommendations for different herbs that we find people test for specifically for bacterial problems.
Yeah, let's just get right into that. Let's not hold on too much to how to get rid of it, because long story short, you just take herbs, deal with byproducts, balance, things should get better. But in order to make specific recommendations, or at least our best recommendations, I think we should probably divide this into a few categories. So let's start with, say, the gut. And a lot of times skin issues because of it. I would argue that a lot of times skin issues are the result of gut microbiome being disrupted. But then UTIs, I think, are a separate category. I think separate things are necessary there. But then upper respiratory things, and then Lyme. Yep. How does that sound? I think that's probably a good overview of a couple of different things.
Yeah, that's good.
So with the gut, I'd say some of the top ones that I'll see are berberines, so things like golden seal, golden thread, organ grape, and then just berberine hydrochloride that's in a lot of different supplements. Barley is also on that list. Those are always a safe bet for the gut. Those are also a safe bet for viral issues. They're a safe bet for helping with blood sugar, insulin issues. Really, really good for the gut. Things that I have seen is things like neem, really helpful. Andrographis, super helpful. Bidens, Chinese skullcap. Those are probably some of the ones that are highest on that list for me. When it comes to upper respiratory issues, a lot of times there are viral co-infections that go along with bacterial issues. So things like elderberry, astragalus, are going to be super helpful. But in addition to that, Chinese skullcap or olive leaf, those tend to be really, really great for bacteria as well as viruses. And so those are really, really good for that. Lyme has a totally, well, not totally different list of herbs, but bidens is super common. Things like petunia or other one we got out there, cat's claw. Those are going to be super helpful. Chinese skullcap is also on that list. There's quite a few that are very, very specific to the Lyme list that will test way more common with Lyme than just about any other bacterial issue. And then the last piece here, UTIs. So UTIs, basically any of the herbs that I just said are super, super common. Within our functional medicine training or our chiropractic internist training, the go-to combo that they'll teach for that is uva ursi in conjunction with cranberry with D-mannose. And ursi is a good broad-spectrum antimicrobial, helps with viruses, bacteria, fungus, all the things. But the cranberry with D-mannose, so cranberry is very protective against UTIs. The D-mannose, it's actually an isomer of mannose, a sugar, that in the D-mannose form, it actually is not digestible. And so the body will actually get rid of it through the kidneys. You'll pee it out. And so the mechanism that is helpful is, ladies who are listening, I'm sure most of you, if not a huge proportion of you, have experienced this. You get a UTI, and a couple weeks later, it comes up again. You just have these recurrent UTIs. Cranberry with D-mannose will actually help strip all the bacteria off of the bladder and ureter walls and clean that out. Things will latch onto there and get on the nooks and crannies, and the herbs and the immune system can't get in there and fight it off. So the D-mannose actually helps clear that off of there, sweep it off of there, and then flushes it out. So that is my go-to for UTIs. So anyway, lots of herbs, lots of suggestions there. What would you suggest, Dr. Joel?
Yeah, those are all solid. Yeah, with the gut health, I'll usually find things like olive leaf, Malia. You mentioned that's the same as neem. I would say those are two of the top ones for gut stuff. Every once in a while, I'll find Chinese skullcap, Scutellaria with that one. When it comes to different immune system infections, especially strep, bacteria there, echinacea is huge with strep. I always find echinacea to be extremely helpful. Astragalus, again, olive leaf, and then probably Malia. Those are all pretty common things. Again, there's like 25 to 30 different antibacterial herbs. So these are just kind of the top ones. When it comes to the UTIs, same thing as what you said, Dr. Tim, uva ursi, D-mannose, cranberry. That combo is really solid when it's a bacterial UTI. Of course, sometimes it can be a bacterial issue coming from the gut, or even an immune system imbalance from the COVID shots or something like that. But those are good there. And then did I miss a topic? There's one more category I thought.
Which ones did you just hit?
I got gut, immune system, and UTIs. Gut, immune system,
Lyme.
UTIs. Yes, Lyme. Yeah, you mentioned the big ones. I would say the only other couple ones would maybe be like Cryptolepis and Cordyceps, and maybe Japanese knotweed or resveratrol. Those are also pretty common ones. With Lyme, I have a hard time giving any kind of recommendations on that one, even though the list is like maybe 6 or 7 or 8 different herbs for Lyme specifically, which I think we covered most, if not all of them. Lyme is so very complex that there's other things with the immune system needed that I have a hard time giving recommendations. I always tell people like, hey, we really need a test to figure this one out. But I would say those are generally my recommendations, my top ones there. Of course, everybody's a little bit different. I'll have 3 patients in a day that have SIBO issues, and they all need a different herb. And so that's just how exciting it is. It keeps us on our toes for sure. All right, yeah. Dr. Tim, this has been awesome. Any other thoughts, comments, questions, ideas before we wrap up here?
We covered it all. Hopefully all of our listeners got some good stuff out of this. Hopefully we don't sound too vague and too hopeless with this, with all the directions you can go. It is specific to what you have going on. So hopefully, say you've got a Lyme issue, say you've got a gut issue, say you've got a skin issue. This can kind of help you dial in kind of the stuff you need to get into to solve what's going on and things to keep eyes out for. Please provoke more thoughts and more questions on your health journey. But I say we wrap it up and get things finished up.
Yep.
So I guess I'll start us off. So I'm Dr. Tim Augustyniak here at Flourish Functional Wellness Center down here in Bentonville, Arkansas. If you want to find me online, my website is draugustiniak.com. That's DRAUGUSTYNIAK.com. On there, have links to all socials, contact info. If you'd like to reach out for any reason, feel free to reach out. But one of the biggest things that we keep harping on, if you have suggestions for episodes, feel free to reach out. We want to talk about the things that you guys want to hear about. We can think of what we want to talk about as much as we want, but this is not necessarily for us. This is for you guys, your enjoyment, and your knowledge. So things that you want to hear more about, please feel free to reach out.
Yep. Love it. I'm Dr. Joel Miller. The practice here is Freedom Health and Wellness in the Dallas, Texas area. You can find me online at drjoelmiller.com and on most of the socials. I'm probably most active on Instagram. Just look up Dr. I think it's dr.joelmiller. Should be pretty easy to find. Again, like Dr. Tim said, if you guys have any questions, thoughts, comments, we'd love to hear them. If you guys need any help or direction, reach out. We'd love to try to help with that as well. If you guys want to schedule an appointment, reach out, contact us. We have patients all the time, of course, locally that reach out, but then people that will also fly in and things like that. So we're happy to make accommodations for all that fun stuff. Other than that, thanks guys for listening this far. If you made it this far, we're excited to continue to bring you some exciting episodes. Of course, our next one's we're gonna have a guest speaker, and it's gonna be a lot of fun. So, all right, with all that said, guys, we hope you guys are having a great week, and we'll see you guys in the next one. Bye.